Ladies and gentlemen, to announce the laureate in the category Public Sector Innovation, let's welcome Professor Liam Smith, Prix Galien UK Committee Member.
Well, I realise I'm between you and dinner. This will be brief. It will be uncontroversial in this room to say that industry plays a major role in innovation, but I think, especially in the UK, the NHS plays such a crucial role, both in healthcare and in our ability to innovate. And the UK government, I'm not saying they couldn't do better, but they're clearly committed to the UK being a sort of global superpower, particularly in health research and innovation. To be controversial for one moment, I would say their idea that we can do this alone without our European partners, or indeed our partners around the world, is a little naive. So I'm delighted that Prix Galien has recognised the importance of the public sector. The UK prize for Best Public Sector Innovation is open to any innovation that has been wholly or majority funded and developed by the NHS or not-for-profit organisations. And innovation, the nominations were for innovations that facilitated and enabled uptake of drugs, devices and technologies at scale within the NHS, and have had an important and really critically had an impact on the health of the population. So let's see the candidates.
In the category of Best Public Sector Innovation, the candidates are Boehringer Ingelheim UK and Ireland for new evidence-based PPIE guide for supporting patient-centric innovation in the NHS with the University of Plymouth and AHSN network. University of Oxford for the randomised evaluation of COVID-19 therapy, recovery, clinical trial.
I am delighted to announce that the winner is the University of Oxford for the recovery trial.
Ladies and gentlemen, please welcome Professor Sir Martin Landry.
Well, thank you very much. Absolutely delighted and honoured to receive this prize. But this is not about me. It's not about my fellow chief investigator, Sir Peter Horby. It's about everyone who's contributed to this. The team, people talk about the team is enormous. As well as the multidisciplinary team of academics, clinical trialists, support staff and so on at the University of Oxford, recovery has involved clinical teams at every single hospital in the country, at 24 sites internationally. It's involved partners across the pharmaceutical sector that provided study treatments essentially free of charge so that we could evaluate them in this trial. NHS and government bodies have contributed, as have our funders, the National Institute for Health Research and the Medical Research Council. That's a long list of people, but I've missed out the most important people. The most important people are the over 48,000 participants who in extraordinary times, at times of real fright, where they were alone because they had to be, they took part in this trial. And we now know which treatments work and which do not in the context of severe COVID, thanks to their contribution. I would just finish by saying that we can't stop and say the pandemic was in the past and now let's get back to business as usual. Business as it was before, as Tim Ferriss reminded us earlier on, was not particularly good business. We have to think about those things that were exceptional and exceptionally good during the pandemic. What lessons can we learn and take forward to tackle the huge and growing burden of common disease, not only in the UK, but around the world? So these lessons are critical for us to learn and take forwards. The things that were exceptional, we have to make routine. The things that were routine and which were failing us, we have to abandon. Choosing to do more is always the easy option. Choosing to do less is the correct option so much of the time. Large, simple, randomized trials tell you the difference between what works and what doesn't, and they make a real difference to patients' lives, the sustainability of the health system, and the welfare of all of us. Thank you very much. It's a pleasure to accept this award.